Good afternoon. Thanks for being here.
Thank you. Thank you, Mr. Chairman and members of the Joint Committee. My name is Dr. Stephen Tharp. I'm an internal medicine physician from Frankfurt. I'm also the Clinton County Health Officer. I'm here today to represent the Indiana State Medical Association and our 9,400 dedicated physician and medical student members statewide. We rise today in opposition to this preliminary draft. We understand that the goal here is to take some necessary steps that would smooth the way to allow the public health emergency to end. We certainly commend the efforts to ensure that federal funding is preserved. We also support ensuring that the State Health Commissioner has the continued authority to issue a standing order to authorize the administration of the COVID-19 vaccine to children who are at least 5 years of age. But we would also note that the standing order language in the bill is not exclusive to the COVID-19 vaccine only. We would suggest that the language be narrowed to the COVID-19 vaccine, consistent with emergency orders that have already been promulgated. We do have several practical concerns about the vaccination language. Many healthcare providers are facing federal requirements to get vaccinated, and that language is not the same as this state language. So we're going to be facing a lot of confusion, including for physicians who own facilities that will fall under those federal requirements. There are several reasons why it makes sense to allow healthcare facilities to require their employees to get vaccinated. One is that their patients may be a high risk, such as patients going through chemotherapy. Another is small physician-owned practices that cannot afford for their staff to be out sick or in quarantine for a week and a half to 2 weeks. Also, on the language that only allows one test per week, the current federal guidelines recommend to get tested between 5 and 7 days after a close contact, depending on the timing of the person's weekly test when they had a close contact and when they found out they were a close contact. They might need to be tested more than once per week just to meet the CDC testing guidelines. We also think the pregnancy language in this bill is dangerously inconsistent with the science and defer to our friends at the American College of Obstetrics and Gynecology who will be addressing this in more detail. Finally, at a high level, we are concerned that this is not the time to end the public health emergency. We are once again facing rising COVID cases. In fact, COVID is booming. Just this morning, I heard from one of our emergency medicine colleagues about how the emergency rooms are packed, hospital beds are full, and wait times are long. And it's the unvaccinated COVID patients that are affected. And flu season is coming. As healthcare workers, we can only do our best to treat people when they arrive in the emergency room, but we still don't have good and widely available treatment options for them once they are really sick. Hopefully there is a light at the end of this tunnel with oral antiviral agents which are coming, but they're not fully available at this time. We need to continue to promote vaccinations for Hoosiers as a way to end this pandemic. We are concerned that this legislation, which seems to disincentivize vaccinations, will result in the prolongation of COVID-19. And prolonging the pandemic would be harmful to the economy, to our healthcare system, and all parts of our society. We all want this pandemic to end, and we share in the frustration of our fellow Hoosiers. But we see patients every day who would have benefited from vaccines. The best way to end the public health emergency is to stay the course until people no longer become severely ill and die from COVID-19. Respectfully, the state needs to continue the current policy of trying to vaccinate as many people as possible. Not everyone may like it, but it is the right thing to do for the good of the state. In the meantime, we need to work together to address the misinformation that is circulating and rebuild trust within our communities. If the legislature is willing to take a little more time, we would be happy to work with you on this bill and try to make sure the health of both our people and our economy continue to improve. And with that, I'll be happy to answer any questions you may have.
Thank you, Doctor. Questions from the committee? Representative Austin.
Thank you, Mr. Chairman. Dr. Tharp, in your professional opinion, do you believe that there should be situations where people are entitled to an exemption?
My professional opinion is that the more people who get vaccinated, the less we're going to suffer from the effects of this illness. If people truly have issues, I can understand those needing to be evaluated and considered. But unfortunately, many of the opinions that I hear are uninformed and actually based on non-factual information. And so we consider every case as individually when we treat patients, and it's very important to try to educate people about what their real risks are. If they choose to take those risks, our responsibility is to try to protect those around them as well.
So let me ask this as a follow-up in a different way. Are there legitimate medical exemptions?
Yes.
Okay.
The legitimate medical exemptions would be a demonstrated allergy to the additional preservatives and things that are in the vaccine that one could be allergic to.
Okay, thank you.
Senator Lannon.
Thank you, Mr. Chair. Dr. Tharp, you're testifying on behalf of the Indiana State Medical Association, is that correct?
That is correct.
In your opinion, is the pandemic over in Indiana?
In my opinion, the pandemic is not over.
Right.
Cases are on the rise, and we are seeing additional admissions as well as further spread of the illness.
In your opinion, is Indiana where it should be in terms of the percentage of people who have been vaccinated?
No, in my opinion, we should be close to 100%, but that we haven't made that anywhere close to that yet.
Senator Lannon, could we keep the questions towards the bill draft?
Oh, absolutely.
Not the policy of the state, please?
Well, we're not going to discuss the policy of the state of Indiana? Okay, that's fine, but I guess one question about the bill. Doctor, in your opinion, does this bill hurt or harm our goals of trying to get more people vaccinated?
I think this bill does harm our efforts to get people vaccinated. I think that the more people who get vaccinated, the less people are going to get sick. We have had over 600,000 deaths in the United States. We have had over 17,000 deaths in Indiana due to the COVID virus. It is my opinion that a number of those deaths are not necessary, that they could have been prevented with a more vigorous use of vaccines. However, we understand that doesn't always work out well, and we have to do what we can to help the most people.
Thank you, Doctor.